Which one?
You can switch. Alex, are you in?
Great, so welcome everyone to the Tools and Technology Seminar Series. I think most of you have been here before. This is just a venue to talk about tools, technologies, methodologies that are being used and or of interest. There's a sign-in sheet going around. Please sign it to help justify the pizza. So today's talk is a little bit different in that we have Matt Cybulsky, who is actually not at the University of Michigan. I know we usually have local people for this seminar series, but Matt is joining us today. And he does research on voice technology, and he's actually got adjunct positions with Regis University, Rochester Institute of Technology, and Chatham University. And I think with that, I'm actually just going to turn it over to Matt.
Thank you. I don't have a mic, but just want to make sure that my voice resonates. Everyone can hear me okay? Okay. So yesterday's talk was a little bit different than today's, probably a little bit more formal. So I want to encourage some informality today. I've got tons of slides. I'm not going to stop on every one. I'm not going to do, your typical sort of linear talk. So as Marcy said, my name is Matt Cybulsky. I am a social psychologist by training. I studied a lot of behavioral economics. I was working in healthcare finance and went back to school to get a PhD. Recognized pretty quickly that people had a hard time understanding invoices, and I redesigned invoices for an entire for-profit health system and learned a lot about human psychology, perception, influence, persuasion. Was able to create an outcome where patients ended up signing up for payment plans so that they didn't end up in bad debt, and didn't lose their homes and cars, which helped sustain their wellness. Marcy is right. I am a presenter that's probably a little different than what you're used to. I am not in an academic home. I have adjunct faculty roles, so I spend a lot of my time out in the market. When I started my company after leaving a medical school as a professor, I started a podcast around the same time. And I think today's podcasts are kind of like, the 90s version of Let's Start a Band. And I started it because when you hang out your shingle to do work, nobody knows who you are and why should they? And I thought this is a kind of an interesting marketing tool. It'll take 30 minutes out of a month, and then I can email people who are important and matter and do really great things, and they'll just talk to me, and that'll lead to a community, and that'll be great. What I didn't recognize was going to happen was my podcast went from 100 to 200 downloads a month to 5,000 to 6,000 to more. We were contacted and started a conference based on the podcast at Harvard Medical School, which occurred this year. And the next thing I know, I'm doing research and talking to people and writing about voice-first tools. Most of you have heard of it as Alexa or Google Assistant. And basically the work that I focus on is all in healthcare. I have had some interactions with finance, and they're very interested in it. And your department is also really interested in it for a number of reasons. The obvious reason to me has to do with the data that's going to become available is just insurmountable to me and incomprehensible. There's going to be multiple less than percentages that we'll be able to even translate by humans, and we're going to have to really incorporate some unique tools to figure out what all this data is telling us, right? So we're going to process language, but there's also going to be recordings. There's some really fun research I'll talk about that some people are doing at Carnegie Mellon, for example. I'll do some other talks about what people in the market are doing. At the end of the talk, towards the end of my talk, I want to encourage some conversation about relevancy to your work. And this can be questions amongst each other or to me, and if I cannot answer them, then I can probably connect you to someone who can, or I can take some time and we can contact each other and I'll find that answer for you. I'll zip through the first part. The first part of this talk is really just saying this is not just a one-off sort of tech. This is here, this is huge, the market's big, it's the fastest adoption of technology in the United States since color television. I'll show you a graph on that and it'll kind of blow your mind. The other thing that I want to have as a takeaway for you is the smart speaker market and the smart speaker talk all of you are getting accustomed to. By the way, how many people in here have an Alexa speaker at home? Any kind? Dot, Show, other? What about Google Assistant? What about Sonos? What about any voice-enabled speaker or device in the home whatsoever? Cable television with a remote that you can speak into, anyone? I love it, great. Kill your TV, no more television. just on demand only, don't expose yourself to all those ads. Well, for you all, you've seen the ads, right? I mean, just ask you that question. That's probably more prevalent to your day-to-day, whether you can escape it or not. You've seen an ad about the Alexa or Google Assistant, right? So the second takeaway is speakers are just a gateway drug, okay, for us to be used to using a voice assistant, all right? Siri in your computer is a common one. Alexa is the fastest, most ran downloadable voice assistant on the market. And it's going to outpace any speaker sales. Why? Because there's an intangibility to it. Once you have a mobile phone, I can download this tool for free and I can use it and I can control things on my phone or in my house. And so there's some other takeaways I'll get to, but those are the two big ones. So it's a huge market, it's here. It's going to go mobile, so don't think about it as a device that just sits. The third takeaway, which I won't really go into, has to do with my backing as a psychologist, which screen interfaces give us an opportunity to give info to it, right? And then get something back. There's an outcome. Your search produced this. Put in a URL, you get this. Voice, I think, and my theory on this, is it has to move beyond the sort of iterative give-take. I think that's where machine learning and AI and the data analysis becomes really important, because I think if people are going to use it, and it has to be something more unique than just a screen interface, analog, it's got to be something new. How are we able to put people into a story that they sort of exist with the assistant, the voice assistant, so that they get information that's useful, not just what they ask for in the moment, sort of serendipitous information, and also creating tools that we use and go back to over and over and over. We can't really rely on will, especially in healthcare, to get people to go and use a voice assistant and expect them to enter a system voluntarily that helps them to eat better or drink less or take their meds or prepare for the colonoscopy. That has to be sort of the next step in all this, is not just the epic of screen to voice, which to me is amazing. There's going to be minds like ours that have to design tools that put people in sort of an emotionally integrated space with the interface. It's sort of a different conception, so it can seem a little bit out there, but I think if these things are going to be useful, we're going to get the data out of it we want and be able to create outcomes that really help humanity as well as create useful meaning to our lives. We have to think about it in those terms. I haven't written a book on that yet, but I will let you know when it's written, and hopefully we'll meet again one day. But that's my idea for this talk. We'll get started. Technology is not communication. I think for those that are in here that exist in the now, you understand that. This is just talking about what I said I was going to talk about, and I'll flip through a bunch of stuff here. Let me start with this. This was produced by a friend of mine from undergrad, believe it or not, that started his own production company. His name is Adam Schwartz. They do some hilarious advertising clips. And this is titled Alexa for Southerners. It is humorous, but it also brings a lot of attention to the market on using these tools. So please enjoy. It's only about 2 minutes.
Amazon Echo. You can do everything from ordering pizza to streaming music with a simple voice command.
Play something slow on the country music station. Okay, here's what I have for extreme constipation.
Unless you have a southern accent. That's why we're introducing Amazon Echo for Southerners. It's packed with the same power and performance as our regular Echo, but built exclusively for Southerners.
Alexa, add biscuits to my grocery list. Okay. Add flour, baking powder, sugar. No, canned biscuits. Why on earth would you do that? Did somebody steal all your mixing bowls?
Our new Southern Alexa is perfect for every member of the family, especially the little ones.
A cheetah is. Tiger. A cheetah is. Tiger. Alexa, which one is faster, a cheetah or a tiger?
That's not how you ask a question.
Please tell me which one is faster.
That's more like it. A cheetah can run up to 80 miles per hour, nearly twice as fast as a tiger.
Ha! Told you so.
Excuse me, young lady, aren't you forgetting something? Thank you. You're welcome.
Southern Alexa also provides accurate weather updates.
Alexa, what's the weather going to be like today?
Well, my left knee is acting up something awful, so we're probably due for a gully washer.
Southern Alexa, available in burlap and reclaimed barnwood. Margaret Center.
So I live in Alabama, and that is to me hilarious, and it touches on some stereotypes about Southerners that are true. SNL did some comedy skits on it also with aged population, and they could never get Alexa's name right. They called her Alice or Amanda or what have you, and it was really funny. I think that sentiment is not great. Like, I think these tools are really useful and not that hard to use. I don't have to have a skill set. I just have to have the ability to speak. Yesterday, when we were talking about this after my other talk, there were some great questions about what if people are deaf or mute? You know, what can you do with that? Later on in this, you'll see a slide that says you can't forget that visuals still matter with this. Like, I'm going to go with like a Gladwell kind of theme on that, which is there's not just one universal. Like, just because we have voice tech it's not the end all for technology. It's another great instrument that takes us to a different place, but you're not going to escape from having notifications that are screen based, or maybe even a screen on a device or even on your phone, and you're going to speak to it. Something's going to come to you, a notification, a color, even the Echo Dots the size of a puck have yellow or red notifications that kind of spin on them and say to you, something's there, interact with me. It's sort of a prompt, sort of a passive prompt. That being the case, let's move on here. Why now? Why does it matter? Well, to me, it does a different job, right? It does a job that a screen can't really do for us anymore. We can do some input to it. We can talk to it. There are technologies now like AI and machine learning and interactivity that it can spit back things to us that really matter. I spoke about that briefly. To me, it's a more provocative job than the screen can do. I actually prefer, as the technology continues to get better, to interact with my voice. All my lights at the house, to my wife's chagrin, are hooked up to Hue lights through Alexa. I even have it flashing when different things happen in the world, i.e. when the Alabama Crimson Tide wins a football game, it all flashes crimson. My wife was an Auburn cheerleader, you can imagine how that goes. But for me, it's a lot of fun. So anyway, it does a job that other things couldn't do for me, right? It's better than a text notification to have a light flash. Oh, Alabama's winning, great, wonderful. 20 years, 5 waves of disruption. Web, we used to put in the physical URL. Anyone remember doing that? I remember before search what that was like. It was really amazing, but still to think about that today is kind of strange. We got to search. We ended up sharing stuff with social. Facebook came along. We thought that was great. It turned out to be the worst idea ever. You can delete your social media, take it from me. Probably a good idea to get off of that. And then we moved to voice. And mobile voice, I think, is sort of hard to dissociate that. I think they're going to be the same, much for the reasons I spoke about early on. So think about voices with you all the time. I think that's the real value. Here's the chart I told you about also. Here is color television. Here is, if you look at that slope, this is the smart speaker. Okay? I mean, unbelievable rise. And if you look at some of these numbers, smart speaker reached 55 million homes in the United States. These are funding for voice tech startups starting in 2004. You can see that rise. Revenue forecast this year forecast $3.2 billion for smart speakers. We're not even talking about like skills that you buy, for example, or actions on the Google market, for example, is the similar one. This is business speak. I threw this up yesterday. And, this is basically the average rise of value over time. Okay, and it's comparing other tech. So it's really out in front, really behind video entertainment and lighting. This is the breakdown of the US population as far as generations are concerned. And what's really important to think about when you look at this and you look at those numbers, and then you look at this and look at these numbers, this is smart speaker owners by age and ownership. If you notice, they're really similar, right? There's not a lot of difference between the ages and the epochs for people who own this. That means it's sort of like this ubiquitous adoption of this technology, which would also explain what that slope that we saw on that previous slide about how quickly this is getting adopted. Let's see. Amazon has largely dominated this market. Everyone has heard of the Amazon Speaker Series. If you look across worldwide, you see Google making some big moves here. Strangely, in the smart speaker market, Apple's not doing very well. But if you look at the mobile market with Siri, they're really the dominant voice tool, even though people would argue about its quality, like how good of a conversation tool it might be. Here are some really interesting numbers from Google, Amazon, Alibaba, and others. Alibaba entered this market Q2 of this year, and they've grown 18% with smart speakers already, just to give you an idea. And Google is really eating into Amazon's market. This is what's going on in China right now. Q4 of 2017 to now, they're really starting to take off on the smart speaker market. You can continue to see that to rise in the future. So there's things that people do with these smart speakers: music, news, live streaming, checking the weather, history, sports. For me personally, I like to, at the end of the day, cook a meal. So I put on jazz music, and then I can get recipes. I have a little Echo Show that shows me, how to do different techniques or how to mix sauces or what have you. I have jazz on the thing, and it's a good way to wind down. Interestingly, I'm not alone in that. I mean, people are using how-to instructions regularly. You also see retail getting bigger. And for me, that is a sign that people are going to be okay, even interacting from a healthcare perspective. And they have been, okay? They even report better satisfaction when they buy things off of a smart speaker or a voice assistant, or even interact with a voice assistant for healthcare information. Let's see here. Something important to think about: 46% of US adults claim that they use their voice assistant on their mobile phone. It's really important because of what I told you earlier. And unsurprisingly, because of the iPhone market in the United States, Siri is really huge with people who report using voice assistants in healthcare. We've sort of dubbed it Care Assistant, because the idea is ultimately that this voice tool will help you take care of yourself and answer questions about your healthcare. Let's see. Again, the theme of mobile phone. This is a mobile thing. It's with us all the time. Who leaves their house without their mobile phone every day, if you have one? Anybody? Who always has their phone with them? Who's looked at data on Apple and seen how many times they pick their phone up a day and been alarmed? Nobody? I don't believe you. It's really profound how these things have kind of like creeped into our brainstem. It's like part of your breathing and sleep cycle at this point. So that being the case, voice assistants will become that for us too. This is another graph that shows the Alexa Assistant being downloaded, so you can download that on any platform, mobile platform that it's available in. Pretty fast rise here. This is end of 2017. Skills. Most skills that Amazon has available are made by third parties. People prefer them and seek them out. That's not that surprising. How many apps on your phone are just made by Apple or just made by Android? Same concept. So there's an entire intangible economy built around interface and a tool that opens up to some other service or aspect. For you all in the data world, what's notable here? What happens when I do a search with my voice versus my hands? Well, I use more words and I search longer. So what does that mean for data? Well, another thing to think about here is the accuracy of processing has gotten really, really good too. I mean, it can really understand dialects, it can understand multiple languages, it can put sentences together and concepts together. It's starting to get even better with that. When it comes to data, voice is going to be just humongous amounts of data to mine and grab hold of, because people are going to be more freely able to kind of search and ask questions, whereas I've got to pull my phone out or I've got to go to a computer and type. I can just say, hey, wake word of whatever tool I have, blah, 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 or do the thing. Even if we get to a place where in your laboratories you have voice assistants to help you get through certain research, same thing. The accuracy, the timing of your reading an output or an outcome or making a calculation in real time becomes more accurate, and your lab books become almost immediate. Those are some simple applications I can think of even in the laboratory space. Let's see here. Telemedicine. What's the difference between telemedicine and voice-first tech? Well, telemedicine uses conversational tools through a telephone. And why would that be? Well, there's convenience. Not everyone has Wi-Fi. The United States is very rural. Most of the world is rural. So there's some benefit to having this. In fact, this company here, Teladoc, is I think the largest valued company for telemedicine for healthcare in the United States. So they'll call patients and remind them of appointments and how you're feeling and do surveys and whatnot. They claim to have pretty good use. People don't hang up the phone on that. But they're going to be moving, if they haven't already, using an interface like a voice assistant through the phone itself, okay? There's a lot of advantages to that. We can go into that later, or you can ask me later. Another company out of Chicago called Amy Solutions, they focus a lot on conversational design, whereas voice-first tools have that sort of built in already. Like, it doesn't necessarily have to be human anymore. There can be suggestions being made about how to connect ideas, and when it goes to fetch data, what data sets it's getting, and the prediction of what should be asked next, or what should be told along with the question that's asked, even if the patient doesn't ask it, which is quite useful, you can imagine. So this is the part of the talk that gets a little out there for some of y'all, and I'll just go off and say that I think this is the part of when you move from screen to voice, it has to be something people want to use, and it has to be more than just giving and taking information. My theory on this is it has a lot to do with creating a narrative. So if you're a patient and you're the protagonist in your own story, you know your history, you know your family history, you know what meds you're on, if you're on any, you know what complications you might have. That tool ought to do the same thing for you. And instead of just asking you to do things related to your health, it should also tell you other things that you're interested in, like a sports score, or playing music that you like, or a book you may be interested in, or news updates, or relevant to your classes or your calendar, so that you don't ignore it, and so you're not fatigued by it. That's what I mean by a narrative where you're the central figure. Does that make sense to everybody, conceptually, what I'm getting at, sort of? I know there's a little bit of lacking tangibility, but I hope, okay, good. Great quote here, the truth about stories is that's all we are. Putting people inside their own story connects memories and important value to them, and it endows them to the tool. Endowing them to the tool instead of the screen by putting us into algorithms that make it hard for me not to say no, right? We're all sort of doing that all the time. If you're a Google user, Amazon user, there's a interface, that an algorithm, everything you search for, everything you look at, starts to feed you information. You start to end up in your own little echo world, echo chamber. You could argue that is really the result of some of the polarity we're experiencing now in the United States, is sort of voluntarily we've been in these little boxes where we're happy to be, and we're not being exposed to other ideas, other people, or other things. I'll keep moving on here. So I work a lot with design of these tools, right? So what are some 4 big features for me if someone's interacting with a voice interface? To me, these are universal features of design for behavior. Perception is everything. We have to really understand what someone understands about what we're telling them. It isn't believe it when you see it, it's see it because you believe it. That's really the true nature of our minds. Reciprocity matters. Why do I use this tool unless it's doing something for me? And sometimes it can do something for me using sort of serendipitous tools, and therefore I continue to use it, right? So I'm giving back to it. If I extend my hand to Dr. Boyle, what is his immediate reaction? That's right, to shake it. Or if I smile and laugh, he usually smiles and laughs back, which is great. Humans you can't say no to reciprocity if you're a human. You just can't. So make sure you always design for reciprocity. And we're lazy. We're lazy people. I mean, how many of you would have come here without free lunch? I mean, besides me, one guy, thanks, I appreciate it. Just kidding. I'm giving you guys a hard time, but you get the idea. If I didn't have to get out of bed today and I could get up at the time I wanted and watch the video I wanted and eat the fruit I wanted and maybe get started around 1 and have a workout before then, I'd do that because I'm a human being and humans are naturally lazy and I've got to get myself going. I have to have a purpose and a reason. All of us have different psychological personas that make that easier for us than other people, but voice tools really can help us get beyond that by just making the presumption early on. This person, this thing on the other end isn't going to do anything unless I give it some information and persuade it to do something. And then habituation of behavior. We can use the 3 other things in there and really good design and create a narrative. We can get to a place where people can habituate new behaviors, neuroplastic theory at work, and really change their health for the better or stabilize themselves if they're in a chronic condition. Conversation design, some other things I think voice can do. Reduce barriers, defaults. What happens when you don't make a choice? It's telling you, hey, you're signed up for an automatic vaccination at the health center. Your appointment's at 3. It might tell you that, and it might not say you can change it. And you're a little more likely to go if it doesn't say, hey, you can change the appointment. That's what I mean by defaults. Simplification, make a calculation easy for you, make a process easy to understand. Social support. If I'm having a bad day and I'm really anxious or I'm really depressed, maybe it connects me to my buddy Peter and it says, hey, Peter, Matt isn't feeling so good. You want to talk to him? Yeah, and Peter's like, hey, Matt, what's up? Heard the tide is doing well and heard your talk went really well and good to see you again. And for social support with the aging, that's a huge thing. Talking to their children, talking to other friends, being involved in their own communities, staying active. Incorporate visuals, I talked about that already. And then you gotta make it fun, you gotta make it interesting. I think that's so key. And it is fun, it is interesting. Like, don't make it boring anymore for people. I mean, when I do a search in Google and I have to sift through all that SEO garbage to find what I'm really looking for, I remember when Google came out and there wasn't really this concept of influencing my search results. And I was like, wow, you know, this is unbelievable. This stuff. I didn't know there was all this. I didn't know there was a Wu-Tang Clan name generator. That's fun, or whatever there might be out there. So I think for voice tools, whether it's in the lab or with patients or even on the clinical side, make it useful, make it interesting. That's got to be a design feature for the future. Otherwise, we're just wasting our time, I think, in really pushing this forward. All right. So another part of this that we'll talk about more in a minute is, this is Jaron Lanier. Anyone heard of Jaron Lanier? Yeah. Who is Jaron Lanier? What is he famous for?
VR.
VR. So a lot of public intellectuals claim that he invented and is the father of propagating virtual reality for all of us. He wrote a really good book recently called 10 Reasons or 12 Reasons to Delete Your Social Media. It's actually a fun book. But he also talks a lot about the economy of tech and how we have not democratized the data we get out of it. Instead, the value, the dollar value, comes from selling the data and mining the data. He says this is kind of dangerous, right? Because of what I mentioned earlier, which is you end up in a situation where you're influencing consumers based on the algorithm you put them within, just to move them towards different places that get them to buy or finance or make choices that really benefit a third party and not, you're shaking your head, you agree with this, right? Yeah, you've probably experienced some of it. I mean, how many people have done a search and then you go back to the computer later and whatever you searched for before is being advertised on the side? Like, when that first started happening to me, I was like, oh, neat. And then afterwards I was like, oh no. Do I really want that to be shared? It's kind of scary. So he basically says we've got to do something a little bit different here, which is double down on being human. He says the features, the services have to be what's valuable. We have to open up the data to people like you all to find out what's going on, and then that should be used by the companies to create even more valuable tools or modify what they've already created to make it valuable. And he says that's a better way forward. We'll talk about security and ethics later, but there's so much more data that can be taken from me, especially if I have a mobile care assistant or mobile device that's on all the time recording passively conversations I have and processing that, or noises it hears in the background. There's some amazing technology that can tell respiration rate. Some people are claiming they can even tell sentimentality in your voice, or even blood pressure by the sound of your voice, the way they process that. So a lot of healthcare data, a lot of personal data. Some people want to have that discussion early on, and I think it's worthwhile. Similar to putting cameras in mobile phones. I remember early on when the smartphone came out, never had a camera. People were kind of put off by all the increase in public pictures people were taking that you could share. Right? I don't want to be in your picture, or I'm just walking through the background and all of a sudden I'm on the internet. Now we don't really think about that anymore, but early on here, I think it's something we have to think about once more. So how does this impact things? I told you that people say they like the experience more. I would hypothesize that because people, when they search for something on Google, for example, claim that that's authoritative and that it's truth. On voice, you're not going to have a choice of things that relate to you. It's just going to be a thing, and then maybe another thing suggested to you to go do. So we have to really consider those things. Interestingly, with smart speakers alone, if you break it down by demographic, Black Americans tend to be the most interested in having a smart speaker, more so than Hispanics and whites. What does that mean for us as far as usability, even in healthcare? Some important things to consider, especially if you're attacking certain chronic conditions or certain populations of people. This is an interesting sort of look at the data. This particular calculation says, I don't even know, anyone know this number? I don't even know how you would label that. I asked that on my podcast and asked anyone to email me or tweet at me, and I got no responses, unsurprisingly. The whole idea, I think, for all of you that's relevant is, this is just a hypothesis of like what people think can be translated out of all of the data in one day that's collected from smart speakers or voice assistants, and that's in 2018. If you notice those charts, we're not even at like max capacity yet. So this number is probably small. So this is your world. not mine, on the data, the storage, the management, the translation. I hope that gets your wheels turning here about possibility. A use case that I think is really important. EMRs are the bane of existence for a lot of providers. They have a screen in front of their patient. If Dr. Boyle's my patient, I can't just be sitting with him having an organic conversation without a keyboard and a screen in front of us. But with voice, I'm able to speak to him, have my examination, my history, and that can be recorded and processed and put into an EMR in queryable fields for billing, security, litigation, risk management, contraindication of pharmaceuticals. And then that means at night when I go home, I am not doing my notes. And that's what a lot of physicians are dealt with, which to me is a huge problem because I'm tired, I'm cranky. When I'm tired, what happens to my mind and my ability to think and make connections? Well, my working memory capacity as I get tired gets smaller and smaller and smaller. I'm not processing like an optimal computer in my brain anymore. And we're arguably hurting the care that we all could end up getting. The other part of this is there are fewer physicians going to school, and there are fewer physicians still practicing. So voice assistants allow us to take care of people, prevent them from even coming in, but getting the care they need to take care of themselves, so that a provider themselves is less taxed and can deal with people who really need that one-on-one care, more so than me or you that might have a fever and a runny nose. And all we really need is someone to confirm it and send us to the pharmacy, or the pharmacy to deliver the medication we may need, or take the nap, eat the matzo ball soup, and drink the Gatorade, and you'll be all right. So the rest of this talk is going to be a little bit more interactive. I think we've got, if that clock's right, about 20 more minutes before Q&A. Am I right? Yep. Okay. So feel free to interrupt me, ask questions during this. I want you to feel comfortable, like I'm not going to judge you. This is such a new technology when it comes to application that I do not have all the answers, and if anyone out in the market says they do, they're full of it. So we're really sort of in this like ideation phase. So let's just go over a few bullets of use cases available for voice right now, or what people have been saying. Content. So there's a ton of stuff you can put and fetch and pull from these interfaces. And think about them as interfaces, not just smart speakers, okay? They can be created for anything you want them to be. You could create an entire interface, for example, of fetching info about questions you have on some reading frame of DNA that corresponds to some disease structure, for example. If you put in the right data tables, it can do that, okay? But let's think about this for provider-side care, because that's where I've been spending my time, and I think it's more relevant for me to speak that way. Content is your asset, okay? So make sure you have the right things in there, the right tables available, similar to what you would have with search. Although with SEO, some of that stuff is kind of locked down, right? So thank goodness for things like Google Scholar and EBSCOhost and others, where you can actually get through a search engine and get to information and content that's really important. Partnerships to leverage use care and implementation. So great that I have a tool. I've got to send someone to a pharmacy, or maybe connect them over the phone to a real practitioner if they need it. Interoperability. I might make an interface that doesn't connect to any diagnostic tool, or any EMR, or any phone. That doesn't help anybody. We have to really think about that and the rules we have for it beyond HL7. Service navigation can be as easy as me as a provider walking through a hospital and saying to the speaker or a device, who's the attending on this floor, who's the charge nurse on this floor, what's the attendance on this floor, if it's private enough, where's so-and-so patient, what room, please direct me there. I'm just getting that information immediately without wasting a step, okay? Reducing time, increasing inefficiencies, better clinician experience, better patient experience, lower cost, better outcomes. Like I mentioned with Dr. Boyle, if I don't have to type in that screen while I'm actually trying to do my work, I'm arguably doing better work. It's probably more safer work, because in the background it's telling me, hey, this history dictates that this person doesn't need to be given this drug, or this was already done for them. You can grab that image, such and such a place, go look at it. It's really important for physicians as well as patients. They feel like they're being heard, that their history really matters. It endows them to the service of that organization and that provider. MD attribution. Do you guys know that most physicians these days are choosing to be employed? Anyone know that? The history of the private practitioner has slowly waned, and being employed is preferential. So if I'm an organization like Michigan and I want to get a really awesome physician to come practice as an employee, I can say weekend nights and weekends are probably open because we have a voice-enabled tool, and we also have safer outcomes because of this tool, and so you're less likely to make a mistake. which for you means your history as a clinician is better and stronger. Would you want to come here to a place that doesn't have that? Well, it's pretty easy. Same with patient attribution. What we'll notice in a little while are there are a few tools out there, Cigna being one, Boston Children's has another that's notable, where parents or patients can say, I've got this issue and I'm curious about this thing. And it can return to them, hey, here's a clinician close by, a dermatologist you can go see that you're worried about. And since you're connected through your profile with Google, we've made the appointment for you. 2 o'clock looks like it's open. Are you okay with that? Yes. So if you don't have that in a market compared to your competitor, all of a sudden the volume and the access starts to wane for people who aren't using those tools. So you're getting an idea. HCAP scores is another thing. Are you all familiar with sort of the true value of the AMA legislation of moving from making money from volume to making money for quality of care? So the AMA, Obamacare, basically created a really interesting format which said, if you don't have great quality care, and here are the metrics we're measuring, one of them is satisfaction, another is readmission, meaning the person got care but they came back to your hospital as an inpatient, then we're going to dock you pay. We're going to take 2, 3, 4% off your reimbursement from the federal government because you're not offering good quality care. Well, if I can have a voice assistant with you, inpatient, God forbid, and when you leave it's with you at home, then all of a sudden your satisfaction for care, your understanding of your care, the likelihood of exacerbation and readmission goes really far down, and my risk for lower readmissions as a penalty from the federal government goes close to zero, ideally. So here's some basic use cases that people are thinking of right now. This is early, okay? It's not even going to be what we end up saying is notable and fantastic, but this is the early stuff. The population of the United States, the population of large countries across the world is in an aging state. Folks that are older love these tools, believe it or not. If you look at the adoption rate for smart speakers, it's really no different from people from 25 to 35. If you look over the age of 55, it's the same adoption. So they're open and able and willing to use this. They love it for communication and engagement with each other, right? So maybe they're retired or they're not working anymore. They can engage with their community, their loved ones, other people who are in their community who are older and are at home. And it can be done seamlessly and easily. Safety and security, I'll go over a company in a minute called LifePod. LifePod is, everyone remember the commercials, I fall and I can't get up? Yeah, Peter's smirking, but there was sort of this meme going on before we knew they were called memes, where you would kind of like yell that out if you fell down at a baseball game or something. But there's an Alexa-based tool like this now that is profound, and it has so many more features. The claim in that even is it can distinguish me dropping this on the floor versus my body hitting the floor. And it can alert immediately a family member or emergency services whether I call out or not. Now that is profound, and that is an advance. And that, for someone who might have mobility issues or get dizzy a lot or has early onset dementia or just dementia in general, could be a lifesaver for them. And also prevent some heartbreak for family that's close by, because it can alert family through text messages as well. General health and wellness, get them out and about, give them puzzles to do, remind them of medications if they have comorbidities, diet restriction, even suggest recipe lists and purchasing lists for the grocery, education and contribution to their own communities. Psychologically, when we get older, a lot of us want to give back. We start to think to ourselves, what can I offer the world before I'm gone? These tools allow a way to do that. This is interesting. This company has, okay, so let me just start this section by saying, you all know about Alexa, and you guys all know about Google, but you may not know that there are other platforms out there, right? And these all have different features. They have different ways of being designed. They have incorporations of AI or machine learning in different capacities. And they're sort of in the market, they're kind of floating out there, looking for use cases, and some are probably better fit for others. Robin Labs is one of them. They have an AI tool for building voice assistants and care assistants that has some sort of predictability built into it. It can be taught new phrases and concepts. So for example, on the Southerner, there are colloquialisms spoken every day where a lot of you, if you've not spent time there, you would not know this was a real way to communicate with people. Ostensibly, these things might be able to pick up on that and also give you feedback. But it can also pick up on other habits and other things going on in the home that gives some tangibility and contextualization that means that the patient is less likely not to use it and more likely to engage with it. And maybe the information through these tools that get fed back into an EMR is more useful, not just more information. Now that's going to be a problem, I think, because you can get a ton of information, but if I'm a physician or a nurse or anybody that's working in healthcare, I don't have as much time anyway because there's less of me. And so now I have to go through and sift through all this stuff? No. The back end of these tools, if they're built appropriately, should be able to give me useful information, not just more information. So making connections for me, simplifying the process, keeping people healthier and safer. Robin Labs has a really interesting tool. It's multilingual, context aware. I would, if I were you, look into them. They've got a bunch of great white papers, some interesting things going on there. Orbita and the Living Man. I started this slide, and Alex, you heard this yesterday. I started the slide and I named it Orbita and the Dying Man, and I thought, that's a little bit macabre and probably antithetical to what the story I'm about to tell you is. So Orbita focuses on voice tool applications in healthcare. They're run by a guy named Nate Trelawney. He's a really fascinating guy. They're out of Boston. They were doing some work with a palliative care and home health agency for end-of-life use cases for voice first, okay? And so they were thinking themselves clinically, like what can we provide, produce for pain management, comfort for the providers or the patients themselves. So they came up with a bunch of different ideas and prototypes. I don't know if it was Nate or somebody else had the bright idea, and I say that with some sarcasm. Let's bring in someone who has a terminal illness and ask them. Like, okay, first of all, that is the best idea, probably should have been idea number one when you're building these tools. Second of all, there's a famous company all of us use daily who did something similar by putting designers and coders, programmers in the same room. That was Apple. And said, all right, people who think differently than other people that focus on function and people that function on form, what would you make if you made the perfect tool? That analog was used for Orbita. So they brought in one particular patient who had a terminal illness, and they said, look at what we've got here. Isn't this great? These are really complex things and can be done largely without an interface for a screen. It can really help your process and make you comfortable. And they said, what do you think? And he said, none of that matters to me. And so they were kind of like gassed and thought, well, there goes a ton of work. And he said, you know what really matters to me? Not the stuff that the clinicians worry about. I expect you guys to do that kind of work. I expect them to offer me the right kind of pain meds and the nutrition management I need. What scares me and what I want is I don't want to be alone when I die. That is what freaks me out. Not all this other stuff. You can give me morphine and opioids and those things work, we know it. But I don't want to be by myself when I die. And my friends and family that know that I'm dying, they have children, they have jobs, and they're in and out of my home. And so they just asked him, said, what do you want? What would work for you? And he said, well, I want a playlist that I can hear songs that matter to me, that remind me of memories and people that I've loved or times that have gone by that give me comfort. And I want to be able to yell it out anywhere that I am if I can't move or if I'm by myself and I'm alone and I can listen to this music while I pass away. So Nate told us this story at the conference about 65 days ago, and it was, it's just a simple story, but it's really tangible, right? Because we all know that we're born, one day we won't be here. What a horrible feeling to think that you might die by yourself. I don't wish that on anybody. And so that's what they did. They just created a wake word for him that automatically started playing a playlist whenever he wanted it. And he curated the songs while he was able to have that going. And I think, if I'm right about Nate's story, that they might have just played that playlist anyway while they were with him. But that was really, yeah, go ahead.
With or without commercials?
Oh, without. Yeah, that would be a bad moment. Hearing a beautiful symphony and all of a sudden it's like, hey, have you tried Alexa yet? So, good question. But I think for this particular case, the example is some of this stuff early on can be simple and it can be far-reaching with that simplicity. And I think for all of you who are students who might be thinking to themselves, wow, this is really complex technology and can do all this stuff, don't think too far deep yet. Just go scratch the surface first. That's really the early place that's really can be useful for all of us. I love that story. I encourage you to share it with other people. Orbita is the name of that company. There's a similar company that works only with the disabled. They're based out of Toronto. I'm going to be doing some work with them. As you can imagine, the tools that you can create for people who are immobile to feed themselves or open doors, answer phones and things are fantastic with voice. And there are a lot of really great early unique, customized cases have been built for people who are in that state, and they just love it. And why not, right? Gives them some freedom. This is LightPod. I talked about that a second ago. So it's basically like an Echo speaker, and the seniors who own it can talk to their friends and the caregivers. There's also prompts and alerts and reminders. So using sort of layered information, visuals, it can be a verbal, it can be a text, report back, how you feeling. I think that's also early on. The idea of sending you a prompt and you giving it back to me, I think is probably something that we should move away from eventually. The tech, I think, will get to the place to do that, and I can tell you why. There is technology at CMU, at Carnegie Mellon right now, where they can use the far field mics and an Echo Dot. By the way, there are 7. And the average amount of mics now in a home that even has one of those is 50 as a function of that multiple. Blow your mind. They can tell how many liters of fluid leave the sewage pipes every day. If you have a refrigerator that's running, it can tell you the model and the model year. It can tell you how many toilets flush and where they flush in the house. It can tell you if it's urine or water being poured down the toilet, the density of that fluid, the amount of that fluid. It can probably even tell the difference between opening a bag of chips and opening a pill bottle. And that's the example that I would like to give you, that it doesn't have to prompt me. It can hear me. Now that, yeah, Marcy is like, I don't like that. Yeah, a lot of people feel a little iffy about it. But I think that consumers have told us regularly and chose convenience over privacy. And we all in this room have done it. Not this guy in the back. What's your name, sir? You're not telling me.
Yeah,
okay.
privacy.
Privacy. But I think we all really have. We kind of gotten used to this idea. You kind of forget you're being recorded and that everything you do is being watched. You just forget. It's just part of your day-to-day. I think for some people who are managing multiple comorbidities, maybe they're having trouble with that, probably would welcome something like that. I know maybe I would, knowing myself. Anyway, I love the concept. I think that the iterative stuff will go to the wayside as the technology continues to be adopted from the research that's being done out there. Really exciting stuff for me. Nuance, they're another company that incorporates some AI into conversational tools. They would be sort of a step to the side, really, of like Teladoc, but they're really focused less on healthcare. They do have some healthcare applications. But they're more about like making appointments and scheduling, and they have claimed to say that they have some interest in building clinic-side tools for the note-taking that I mentioned to you. And they do some cognitive prediction, similarly to what I mentioned, where instead of just one give and get, it's a give and then a series of questions or data that's given back to them. They have some interesting stats, some real business speak down there. But basically what they're saying is they've reduced missed appointments, and they have resolved initial phone calls 81% of the time. Yes, sir.
As you already talked about, when you do a Google search, you have to sort through all the SEO crap.
Yeah.
Right? You do a YouTube search of anything, you have to watch or skip a bunch of ads.
Yeah.
Right?
Yeah.
Same thing applies with Spotify and everything else that you do.
Forcing you to pay.
Sooner or later,
Yeah.
advertisers will get into whatever environment they can
Sure.
to influence consumers.
Sure.
What prevents them from getting into an Alexa system or getting into any of these voice first?
Well, for Alexa and Google, nothing. In fact, it'll probably end up being encouraged. And you bring up a great point, and it's right on time, because I'm going to talk about platforms that don't give data away and are enterprise specific. And what I'll say later, I mean, I'm glad you're going that direction, because I think platforms that say to businesses or people, we can build a tool and the data isn't anyone else's but yours, and you can keep it safe on a private server, a privacy that you choose.
And that's worked real well for Facebook lately.
I'm sorry?
I said that's worked real well for Facebook and a lot of other places lately.
I'm not sure. You mean with the recent sort of
Hacking.
Well, yeah, of
They got
course.
hacked.
Yeah, I think that's always going to be a risk for us, most definitely. But I think that if I was choosing to build a tool that was built for consumers and advertisers versus a tool that was built for just my company alone, with a little bit more of a guarantee of that privacy and security, I'd probably go with the latter. There's a company called SoundHound. They're going by Houndify now. That's one of those tools you can download on your phone. I suggest you try it out. They are doing some work with autonomous vehicles, where they are putting these into cars. In fact, Hyundai already uses their tool, or one of their tools, and they're developing others with them to incorporate some AI and some prediction into that, which ultimately will lead to what? well, voice control while you're not even driving your car. I mean, that's going to be a really important thing, and that's where they're headed. And there's important implications of that. Another company called Pullstring that I really like is built by former Pixar executives, and you might not be surprised why I like them because of my narrative sort of thought on where we go with these interfaces. They love the idea of narratives, so much so that they put their tool in a Barbie. And there's some great data from this that I think is applicable for healthcare or any other use case. And it has a lot to do with lapse of use, activation of use, and how long you choose to use it. This particular research was done on, you guessed it, children. And when they came out with this Hello Barbie, they tested it on kids. You know, they had a research group doing it. And the average amount of time, mean, that a child played with this doll consecutively was 2 hours. If you have children or been around children, it's remarkable to think about. And because of the tool they set up where the kids could ask it questions and it could ask back, and just like a normal, non-linear conversation we have with people that you like hanging out with, the kids loved it. The longest time that a child played with it was 6 hours consecutively, and the researcher had to walk into the room and take the doll and say, time's up, here's your juice. This is getting to the level of abuse, so you need to stop playing with this toy. But the point I'm trying to make here is these things are absolutely like just captivating for children, and they are for adults too. When you're right with a really nice, contextually sort of advanced conversation tool, it's like speaking to a friend or like a smart person you really respect who has interesting things to say and relevant to you. You do want to interact with it. Pullstring is not going anywhere. I think they will end up being a name you hear a lot. And I encourage you to go to their website, check out their white papers, and take a look. I think for healthcare, they're very applicable. This is the, see you later, this is the Boston Children's Group. This gives a little bit of a map of what they're doing. Essentially, parents can say, I'm worried about a fever, and they can connect them to a real person, and that person can end up making appointments for them and getting them into their system. In the Boston market for pediatrics, that has been a huge win for them, and they're going to be iterating on this tool farther and farther. We move on here because we're going to run out of time. Yesterday was brought up about doing just that. Like if I have a healthcare tool and it's AI dependent, context dependent, what are our risks of doing that? Like what if I give someone the wrong detail to take care of themselves, I totally misdiagnose or miss a symptom, and someone's got a horrific, appendicitis, and I just tell them to take Alka-Seltzer, and they end up rupturing and getting really sick and sepsis and dying. Well, that's not, first of all, that's not good for litigation. Second of all, it's just not good. Right? Like you don't want to do that to somebody. God forbid. Right? I don't want to hurt you. I want to help you. I think that those are questions that need to be asked. Also, does the FDA consider this a device? I've seen some things that says that there's some argument over that. Like, is it a platform or is it a device? What kind of information, if I'm exchanging, is considered, influential clinical advice to somebody? I mean, MD, what's that? There's a website. I'm blanking. What's the popular? WebMD. Yeah, WebMD. WebMD gives that information. No one batted an eye when they came out with that website. And we all know, I think, that people tend to think that anything they get off a screen tends to be authoritative. The same is going to be true with these devices, except I'm not going to have comparisons, right? I'm going to be told one thing maybe, or given a piece of advice or a recommendation, and I'm not going to scratch my head and say, oh, let me ask that a different way. I'm probably just going to go with it. All right. So it's something for us to consider in the design, especially of healthcare. And if you're using these in research applications, maybe the same. Maybe you're using it with some sort of statistical program, and it doesn't recognize a type 1 or type 2 error that's really important. And the next thing you know, you're basically working off of an error the rest of the way, and you're wasting everyone's time and money. Security, we brought that up. I think the problems there are probably the same that they are now. Except that we have people that come to our homes or that might be around us having conversations, and my voice assistant on my phone picks up on it and processes it. How is that different than taking a picture of Marcy walking behind me when I'm in front of the big house? And maybe she doesn't want to be on my social media picture, but I put it out there. She'll never know, really, or will she? With face recognition, that's an issue. We also have voice recognition that's pretty darn good. Voice signature recognition. So not only would you be able to pick up on third-party conversations in healthcare, for example, but you could identify who that is. So these are considerations to have. These are questions to be had. Safety concerns, we talked about that. And then all these microphones. Passive monitoring is something that I'm pretty excited about. If I can hear myself when I go to bed, my respiration rate, maybe there is a true tool that can tell me if I have high blood pressure based on the way I sound. I don't know if I would say no to that, to be honest. I actually might be open to saying, I know these are silent killers, and if I'm not that aware of myself and someone else can help me with it, I might want that. But we need to figure that out. We need to vet it. Long story short, between bioinformatics, passive monitoring, voice assistants that are going to create new channels of interface and interaction with people and stuff, we're really, to me, kind of experiencing this consilience of, as E.O. Wilson would say, of multiple faculties and multiple disciplines sort of gelling into one. I think it's more important than ever to be interdisciplinary about how we approach these problems and invite people like me who may not have expertise in your expertise to talk about ideas and problems that we see, and maybe vice versa, talk about how we can help you with similar issues, or maybe you can bring up issues we haven't even thought of that can help us a lot. I encourage a continued sort of dialogue amongst multiple disciplines when it comes to this, especially with people in your seats who are, in my mind, information, data, understanding experts. But that's E.O. Wilson, Alabama graduate, Nobel Prize winner. All right, I have a podcast that accidentally got popular. And it's fun. And the talks we have are great. And I encourage you to listen. And if you have questions for me anytime about getting in touch with any of the people I've had because you're students, I will absolutely introduce you. Just let me know. We have another conference coming up this fall, or this next fall, at Harvard again, based on the podcast. Should be bigger than this last year. Anyone from Michigan who's in this department that would like to go, get in contact with me, either a free ticket or deeply discounted if you have friends in Boston. It's a no-brainer for you if you're interested. And then in Chattanooga, Tennessee, there is the world's largest Alexa conference that is also related to me and my friend who started a publishing company. I don't make any money on this, so I just wanted to clarify that really quick. But we have 4 verticals, healthcare being one of them, storytelling another, publishing another, and I think automotive the 4th. So there are going to be booths there that are also at HIMSS. Chattanooga is a great town. They have the fastest fiber optic in the country. They are really looking to build a tech community and there are a lot of great startups there that you can look up yourself and find. It's not an expensive place to be. It's not hard to get to. So if you're interested in that, that's January coming up. So just get in touch with me. I'm more than willing to get you in. Just look at the companies coming or the speakers coming, and if you have interest or you know someone who has interest, just connect us. Happily we'll do that for you. And then discussion. What else can I talk to you guys about? What other questions do you have? What did I miss out on? What did I not connect with? Yes?
Could you comment on the possible implementation of voice recognition into wearables?
Yeah.
You had a bit on the Apple Watch, but things like clothing.
Yeah, so you bring up a good point. First of all, before I comment, I'm just going to say I'm not an expert on the wearable space. But what I will say with the microphone sensitivity and recognition capability is start to wonder, why do we really need them? All right, so if I can tell my respiration rate and I can tell my blood pressure based on the sound of my breathing or my voice, maybe a wearable, because it actually takes the act of putting it on and charging it as a separate device every day or every 3rd day, it might negate that. But so far the platforms work. I think Siri is available in the Apple Watch, if I'm not mistaken. I think you can probably build it into any other tool as long as there's a phone or another device associated with it, and it can process and do things and return to you. But that's as far as I really know. I also think that there is some trepidation about moving forward on the wearable market, mostly because of what's going on with recognition, speech recognition, and the microphones for these devices. I will take it a step further and say, I don't know also, and I'm curious about the sensitivity of the mobile mics. If we're really going to be truly moving towards voice assistants being mobile, how sensitive are those? Are they far, near? Can they have the same capabilities as the Echo Dot or the Echo Show, or equivalencies with Google or any of these other companies, Sonos included? I think it's something to think about. It might even be a sort of a limiting factor in their growth and utilization. That was a great question. Thanks. Others? Yeah.
A couple of times in the talk you mentioned a scenario where I'm talking to my physician and there's a voice thing that's listening and taking our conversation and translating that into information in the EHR.
Yeah.
Is that like future, or are there people working on that now?
There's people working on it now.
And with the best of those systems that are available, I mean, how accurate is the thing in taking the lay language that I'm using and actually converting that into something useful in the EHR, that's accurate? And
Yeah.
Because you talk about the safety and everything, which was the promise of the EHR.
Right. Yeah.
You don't want to fill it with junk.
Sure.
So
And it is full of junk.
yeah.
One of the major issues you have when you have a patient encounter is Control-C, Control-V. And people do that because they're afraid, although the legal research says they ought not be. But it still makes going through that information as field and typed text problematic. Now, there's sort of drop-down fields and input fields that are more accurate for screen interfaces, but you ask really important questions. So there was a slide I showed which showed the accuracy of that processing for words, dialects, etc. It's getting closer to 95%. So that's about as good as humans. I mean, if you look at the research according to linguistics, I misinterpret, like, hearing about 5% of the things that come out of your mouth, even the tones of which. Like, if I might misinterpret the way you say, let's go for let's leave, or I'm just excited about this football game, for example. Like, I'm going to be about as good as the Google Assistant, or actually the Google Assistant's going to be about as good as me. So, yeah, that's a really great, huge concern. Now, let me break it down a little farther about how this might actually work. So, let's say you're my provider, and I'm sitting with you just a basic annual exam. Well, you might start off by saying, hey, Matt, what's your first name?
Alex.
I'm Dr. Alex, and I'm here to take care of you today. And when it hears Dr. Alex, it queues up an HMP that you know exists, the patient doesn't. And then you might say, let's talk about some of your history and physical really quickly.
So this would be kind of scripted.
Well, not so much scripted as there are phrases and words that will correlate to boxes that normally you would type. Now, the 2.0 of that is we don't need that. We can use machine learning and AI from all these recorded encounters that you might have had over 4,000 different patient encounters in your career, let's say. And it just says, okay, well, when Dr. Alex starts with this phrase or this tone or what have you, he's going over pharmacy history. Or he's a little concerned, we can tell in his voice, that this person might be abusing opiates. And so let's put this in a special section and code it a certain way. You get the point. So it starts to sort of hear what you're asking, make some prediction, and then it can fill in either fields that are queryable for data, which are huge, or free text, which is also important in many ways. I think another question that I've asked a lot of physicians that they're extremely bothered by, and also see the value of, is why wouldn't I process and record? All right, so separate sort of processing mechanism for my encounter and then a recording of that encounter. On the one hand, that's great. It protects me a little. Or I can go back and say, what did we talk about here? Because I'm curious or because we're doing a research project. Or it could be damning, right? So what I choose to have processed versus what I choose to type versus what I choose to be recorded are sort of three different places that conversations and preferences and things like justice and fairness have to be vetted. But to answer your question, that's sort of the basic way that your conversation with me as a provider would work, where this machine is starting to input the data because it can make some prediction based on how we programmed it or set up the system of machine learning inside of it or the AI engine we've created for it. Does that help? Yeah.
So I think maybe we'll end there since
Okay.
we're over the hour.
Thank you, everybody.
Thanks.
If you want to email me for more info, or if you want to connect to any of those companies, or you're doing research and you want me to help you find someone who might have some relevancy to what you're doing, reach out, call me, text me, email. Just make sure you make a really clear subject so I don't delete it. Thank you.